As the UK has recorded 50,000 daily cases for the first time in 3 months, we're asking if it's time to make wearing masks mandatory again.
So joining us now is MP and former Navy medical officer, Dr Andrew Morrison, who says we shouldn't be forced to wear masks, and Dr Samantha Batt-Rawden, a senior intensive care doctor, who says they should be mandatory. Let's come to you first of all, shall we, Dr Rawcliffe, and say, why do you feel so passionate about the idea that people should wear masks? I mean, obviously you wear it in your intensive care work. Why is it so important?
Morning, Kate. Well, I think you can see from the stats that we are in trouble in the NHS. The cases are going up. They've gone up 9 days in a row. Hospitalisations are going up. Unfortunately, deaths are also going up. And what that translates to on the ground is an awful lot of pressure. At the moment, about a fifth of our intensive care beds are taken up with COVID patients who are ventilated. Unfortunately, the majority of them are young and unvaccinated, which is really difficult on all of us. And that doesn't sound like a lot, but when you've got 8 ventilated patients and 8 people on that day who need urgent operations, big operations for cancer, which can't go ahead unless they have an intensive care bed, those 8 people needing those operations are going to get cancelled. And that's happening every single day. Now, we did that during the pandemic because we had to. We absolutely had no choice in peaks 1 and 2. But we do have a choice now, and there is a plan B on the table. So for NHS staff who are struggling with this every single day, who, frankly, you know, we are giving substandard care at the moment because we are so stretched, to have this plan on the table, which simply says, please put a bit of paper cloth in front of your nose and mouth to protect each other in the NHS, and we're not doing it, it's really hard for NHS staff.
Andrew Mullins, you're an MP, but you're also a doctor. I'm sort of... sorry, Morrison, I called him Mullins. Andrew Morrison. I'm sort of perplexed. You're a doctor, and we've got the BMA who are saying that the government have been willfully negligent. They are calling for restrictions. Why aren't you?
Well, good morning. It's great to be on your show. The BMA is a doctors' trade union. It isn't a medical royal college. It's not an expert in these matters. What I would say is that I don't mind about mask wearing. I wear a mask on occasion. I do lateral flow testing where I think I really need to protect other people. And I think people should do that. But what I'm really worried about is that by talking about this all the time, obsessing about it, we're actually losing sight of what really matters. And that's the thing that's going to get us out of this pandemic. It's the vaccine programme. It's been hugely successful up to this point. And if I had a concern right now, it would be the risk that this wonderful programme and also the flu vaccination programme, which is equally vital, appear to have stalled. And I really want to get it back on track. I think that's really what's going to do it.
We do talk about that a lot on our programme as well, and our viewers are very, very keen for that to go ahead too, and get involved at all times. The problems with that, though, is that's not in our individual control, is it? We're trying to get our appointments, we're trying to get people vaccinated. There's problems at the moment with the setting up of the booster. We've discussed it many times, what can be done about that. Why does it have to be one or the other? What is wrong with wearing a mask as well as getting vaccinated? We ask people to put seat belts on. We have all sorts of things that we tell people to do for their safety and for all our safeties. Why is it a problem to tell people to put a mask on, in your view?
Well, I hope people will wear a mask where it's appropriate, but I don't think it's right for government to just go around telling people, mandating people to do things.
Why?
Unless it's absolutely
Sorry, just so that we understand your position. Why is it wrong?
Well, because I don't like telling people what to do unless we really have to. Now, it may be.
Well, hang on.
That we do
I'm sorry, Andrew. I'm sorry, Andrew. We're not going to have a lot of time, so we've got to get to the points here. I'm sorry, but as Kate said, we tell people to wear a seatbelt. We tell people not to smoke inside, in bars, why don't we say to people, actually, make your own mind up, actually? Because, actually, somebody might think, well, there's no one in this restaurant, I'm going to light up a fag, that's fine. We don't allow that. We allow for no ambiguity. And we're not asking for a long-term law here. We're asking for just a temporary ruling, like we've had before. Just get people to wear masks. You've admitted that you wear one yourself on the tube. So why wouldn't you want others to wear one too?
Well, because I do believe in personal choice. I think that's important. In Scotland, for example, where they're far more hard over on wearing masks, the incidence of death and hospital admission, serious illness, are not as good as they are in this country. And throughout Europe, the picture is mixed. And I'm afraid the real life experience of mask wearing isn't what you might think in terms of our chances of using it to reduce the transmission of this condition. It may help, but it's only one of many interventions. And I'm really worried that if we obsess about this, we'll lose sight of what really matters, and that's the success of the vaccine programme.
OK, well, it's an interesting point and one that I've made, and there isn't complete evidence on any of these factors yet, is there? I think time will tell what's really helped or what hasn't. Good to speak to both of you this morning. We asked you on Twitter at home, should masks be made mandatory again? Almost 75,000 of you voted. 51% said yes, 49% said no. So I think, Dr Morrison, your dream of this debate not happening is not going to happen, I'm afraid, because people are still so divided. But thank you for talking to both of us this morning.